My name is Erin Hennessey. I'm a nurse practitioner at Blush Aesthetics in Ohio. I've chosen to partner with Sciton for a variety of reasons. The first of which is that their equipment is incredibly reliable. And when you own a business, you need to be able to know that your machines are going to turn on every day for you and that they're going to do a good job. The second reason is that they are incredibly efficacious. I have very discerning patients and I myself am a very picky provider. And so I want to know that the treatment I'm going to do is going to get a certain clinical outcome. That's very, very important to me, but it's also important to my patients. The third reason that I chose to partner with Sciton is education. I always want to make sure that not just myself, but also our staff members, our nurses, our nurse practitioners are continually growing in their knowledge, and Sciton offers us those opportunities regularly to continue to do a better job for our patients. So I believe the treatment that has most impacted our patients is broadband light therapy. And it really is the foundational treatment that we utilize, that we kind of build everything else on. I use the analogy of building a house when we're talking about skin. And in order to have a wonderful house, you have to build a really nice foundation. And that's what BBL does for us. So whether it's fine lines, wrinkles, redness, brown spots, acne, those are all things that first we start treating with our BBL treatments, but we also utilize it for maintenance therapy as well. So after we utilize our corrective therapies, then we like to see our patients back every 3 to 6 months for their broadband light therapy. So for summer, my go-to Sciton treatment is always going to be moxi. So it's been a wonderful addition to our practice. It's lovely that you can use it on all skin types at any time of the year. Obviously, for the healing process, we love to educate our patients about wearing SPF along with hats, and that's just going to be a lifestyle change that they have, not necessarily having to do with the healing process directly, but we want to always make sure that we're protecting our skin after we're doing corrective treatments. In the winter time, I would say that our go-to treatment is a combination of broadband light, halo, and then depending on if there's small areas that we want to correct, adding TRL or profractional to that. We love stacking those treatments together in the winter for patients when we can really get a good amount of time for them to heal and really make great changes in the skin. For skin polishing, again, I really love moxi for that. A lot of times we are combining our moxi with profractional to also get some skin tightening. So the combination of those two together, if they have some pigment, if they have some rosacea, we're also adding broadband light to that. So broadband light first, then we're doing moxi, and then we're doing a light profractional on top of that. There's really very little downtime to it. Patients can typically wear makeup, or we say time out of makeup is only a couple days, and they heal beautifully. They're nice and bright and glowy and polished. My advice to a provider who is looking to invest in technology that is not only going to give wonderful results, but is also going to be able to address a multitude of skin concerns in all types of skin and ethnicities in their practice, I would always recommend Sciton technology.